This is the virtual open house information session about our really awesome online Master of Science and Graduate Certificate program in palliative care. My name is Lynn McPherson, and I am the Executive Program Director of our awesome program. And I'm happy to share some information with you during our time today. And you're welcome to jump in at any point if you have a question, or wait till the end, it's up to you. So I think everybody knows what palliative care is, but just in case, to make sure we're all on the same page, this is the World Health Organization definition, an approach that improves the quality of life of patients and their families facing problems associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems. And we take this very seriously because in our master's program, we do address the total pain picture, whether it's physical discomfort, psychosocial, spiritual, financial, whatever it may be. So first off, what is the deliverable? Let's begin with the end in mind. That's how we do instructional design. So the big kahuna is the Master of Science degree in palliative care. So when you're done this program, at the end of your name, you would put MS for Master of Science. Along the way, or in lieu of the master's degree, you can accumulate graduate certificates. So for example, I'm going to share the curriculum with you in just a moment. But when you take the first 4 courses in the program, which are required courses, you have earned the graduate certificate, Principles and Practice of Hospice and Palliative Care. Now, some people, that's all they want is that graduate certificate, although I will say overwhelmingly people go on for the master's degree. Then when you take your 4 elective courses, we have several different tracks. If you take all of your electives in that track, you can earn a second graduate certificate. So we have a clinical track, which is far and away our most popular because we have a lot of clinicians in this program, but we have a leadership and administrative track, psychosocial, spiritual, and a thanatology track that is an option as well. So most students graduate with the MS degree and 2 graduate certificates. So I guess this is another important question is why the heck should I do this? So who signs up for this program? And I have to say, this program has been an amazing success. I know that when I first designed this and started it, I had hoped that when we reached our peak, we would have 50 students in the program. Well, we've had about 50 students graduate last summer, and we have about 250 students in the program right now. So this has really been received a very warm audience all around the world, but particularly obviously in the United States. So the online Master of Science is designed to meet the needs of people who are currently working in hospice and palliative care. I would say probably 2/3, maybe 3/4 of the people in the program already work in hospice and palliative care, but they want to either deepen their understanding of either the clinical, psychosocial, or the leadership. Maybe someone wants to go on and assume a leadership role, for example, so they might want to do that leadership track. It could be also, we have people who either want to switch to the field of hospice and palliative care, or we have a lot of people, for example, in the 4th bullet, people who want to complement another area of specialization. So for example, we have a lot of advanced practice nurses who work in the ED or the ICU, and they want to gain these skills in palliative care. To prepare for hospice or palliative care certification exams. Even I wouldn't say you should do a whole master's degree to prepare for a certification exam, but I will say with this degree under your belt, you are ready for literally any certification exam out there, because you'll see in a moment how I did the instructional design of this program. And basically a large part of it was looking at those certification exams. And I skipped bullet number 3. So we have a lot of physicians who want to transition into hospice and palliative care mid-career, but they don't want to take time off and do a 1-year fellowship. So some hospitals are accepting the Master of Science as the credential to allow those folks to practice in that institution. So a lot of reasons why people do this. All righty, who should do this? Well, I think anybody with a pulse should do it, but maybe I'm a little bit biased. I personally believe that every school of pharmacy, nursing, medicine, and social work minimally in the country should teach their students primary palliative care skills. But, you know, that doesn't always happen. But I would think, you know, there really is an appeal for such a wide range. And we do have this wide of a range in our program. So we do have physicians and pharmacists, nurses, advanced practice nurses, PAs are playing an increasing role in hospice now, as you know. We have a wide range of therapists in our program: OT, PT, child life specialists, psychologists, administrative people who are entirely accounting, leadership oriented, a lot of social workers, chaplains, counselors, bereavement people, volunteer thanatologists, and then other. We have a dentist, we have a dental hygienist, we had a veterinarian graduate from our program. We have a missionary from Africa in our program who's just crushing it. So as you can see, this is a pretty far-reaching degree with wide applicability. So how did I design this program? So it took me a year to design the program, and I looked at the competencies and outcome statements from the Joint Commission for Palliative Care Programs and the National Consensus Project. And then I looked at, for example, the American Board of Medical Specialties exam, the certification exam for physicians. I looked at the Hospice and Palliative Care Medicine and Trustable Professional Activities from AAHPM. The Hospice Medical Director's exam, nurse exam, advanced practice nurse, aid, leaders, everything. So I looked at all the chaplaincy, social work, and I looked at all of their outcomes and competency statements, and I put them in a big bowl, and I stirred and I stirred and I stirred, and I came up with 14 terminal performance objectives. And these are they, which are a little bit hard to read from this screen, but the ones in purple are interprofessional education, because as you can see, I just shared with you, we have such a wide range of people in this program. So these are the terminal performance objectives. What do I mean by that? By the end of the degree, everyone who graduates should be able to accomplish all 14 of these TPOs. Every single TPO is introduced in the first 4 required courses, and then every single TPO is emphasized somewhere in the electives, and then every single one is reinforced in the last 2 required courses. So it's at least introduced and it is emphasized, reinforced, and depending on your electives, they may be emphasized as well. Alrighty, so a little bit about program structure. Each course in our program is 8 weeks long. So because we have 8 weeks, we have 8 modules. Each module begins Monday at 12:01 a.m. and ends Sunday night at midnight in your time zone. So this is important because we have students who have to complete assignments and discussion posts, for example. So one is due Thursday night at midnight, but it's in your time zone, and then assignments and so forth are due Sunday night at midnight. So the way it typically works, as you can see here, and I've just grabbed the fall 2020 as a starting date. We can have students start in summer, spring, or fall. If you start in the fall, Fall A is the first course, and this goes from August 24th to October the 16th. As you can see, you've got the weekend off, and then boom, on Monday, you roll right into your next course. So that would be October 19th to December the 11th. Then you're off for a little bit more than a month over the holidays. Then you have a spring A course from January 19th to March 12th. You have off for the weekend, so party like it's 1999. And then spring B, you start March 15th, and it goes to May the 7th. Then you're off for almost a month, and then we have one course in the summer that goes from June 1st until July 23rd. So that would be year 1, and then if you're going on for the master's degree, you would repeat that year, obviously with different dates, but similar to these, for year 2, and you would graduate the end of July 2022. So that's the structure for our program. So our curriculum, this is kind of the 20,000-foot view. I've alluded to this already. There are 4 required core courses, which I'll show you in a moment. Then you take your 4 electives, and then everybody comes back together and takes the last 2 required core courses. These are the first 4 courses. Again, remember, all the terminal performance objectives are covered and introduced in these first 4 courses. The very first course, I want to make sure you all are aware of the chat box. Eric Lee, who's our Senior Academic Program Specialist, is typing in some web links for you as we move along. So sorry I didn't introduce Eric earlier. The first course is Principles and Practice of Hospice and Palliative Care. Another feature about all of our courses is they're pretty much all taught by 2 or more faculty members of different disciplines. We have one course that I think has 5 or 6 different faculty members. We have the last course in the program is taught by a pharmacist, a physician, a PhD social worker, and a chaplain also chimes in to help with some of the discussion questions. And this is important to me because this is an interprofessional program. I think it is so important, for example, in the symptom management course in advanced illness, I think it's important that the chaplain and the social worker and the administrator know how to assess anxiety and depression so that they can say, you know, I think this is actually a medical problem. I need to alert the nurse case manager, for example. Similarly, I think the doctor, pharmacist, nurse, advanced practice nurse, PA need to be skilled in psychosocial, cultural, spiritual care. So we do a lot of cross-training. I'm a big fan of transdisciplinary care. So first course, Principles and Practice of Hospice and Palliative Care. I co-teach that with an advanced practice nurse. Next, we have Communication and Healthcare Decision-Making, which is advanced directives, goal setting, and so forth, taught by an advanced practice nurse and a social worker. Psychosocial, cultural, spiritual care is taught by a social worker and a chaplain. And symptom management in advanced illness, I co-teach with a physician. So that's 2 in the fall, 2 in the spring. When you're done those 4 courses, you've earned your first graduate certificate, Principles and Practice of Hospice and Palliative Care. Moving on, then we have our elective. So as you can see, I actually made it harder on us than I had to. So instead of just saying, we're just going to do clinical courses, we have a bunch of courses. So as I said, most people pick the clinical track. And if you chose the clinical track, you would take advanced pain management and opioid dosing, which starts June 1st for us. And then that's followed by advanced non-pain symptom management, advanced disease state management, and clinical management of special populations. And these are exceptional courses. I'm so proud of these courses. Well, all of our courses. But for example, the clinical management of special populations, I co-teach that with 3 palliative care emergency boarded physicians from Emory, who just do an amazing job. That's an awesome, awesome course. So if you take all 4 of those courses, you get a second certificate in clinical hospice and palliative care. Similarly, we have an administrative track, hospice leadership, palliative care leadership, practice development and strategic planning, and principles and practice of palliative care education. Same, we have a psychosocial spiritual, and we have a thanatology certificate program that's really through our School of Medicine, but if students want to take any of their courses as an option, they can. So as you can see here, if you stay in your track, you get another graduate certificate, but the beauty of our program is you can mix and match however you would like. So you may say, I think I want to take advanced pain management with palliative care leadership and self-care and psychosocial perspectives in aging. So it's nice to have options. I'm a big fan of pedagogy, which is self-determined learning. And then everyone comes back together for the last 2 courses, research and outcomes assessment in hospice and palliative care. People are scared to death of this course. Research, oh my gosh, what's that all about? But it's a wonderful course. Again, it's only an 8-week course, so you don't actually do the project, but you move from coming up with an idea, like I wonder, looking at some kind of an outcome, clinical, economic, or humanistic. So it could be, does drug A work better than drug B? It could be, does counseling by the social worker or the chaplain lead to greater satisfaction? It could be, does having the admission nurse go to the hospital reduce the financial implications of admission? I don't know, I'm making this stuff up, but you move from forming that question to now you have sussed out your proposal such that you were going to submit it to an IRB, for example. And while students do worry about this course, it ends up being one of the favorite courses in the program. And my favorite course in the whole program is the very last course, which we're gearing up to teach June 1st again, Advanced Team-Based Palliative Care. This is an amazing course where you do work in teams, and we take a little bit different approach to this course, where we focus on 3 disease states. We look at a patient with COPD, which turns into lung cancer, an Alzheimer's disease patient, and a patient with heart failure. And each week the patient gets a little bit sicker. So we move through palliative care, and then we move through hospice right up to the time of death. But that's an amazing course. What are some of the course activities? What do you do in this program? A lot of people think about online learning as it was 20 years ago, which was talking heads, where a professor would take their lecture, sit in front of a camera, and record a 50-minute lecture. We have no talking heads in our programs. So again, we have the 8 weeks, so we have 8 modules. So each course has learning objectives, and each course, all the course learning objectives support the terminal performance objectives. And then within each course, each module has its own learning objectives. So when you log into Blackboard, is the platform that we use, you may be familiar with that. You will see for each module the same type of cover sheet, and it starts off with the module objectives and a little paragraph describing what we'll be doing that week. Then we have listed your learning objects. It could be a reading. We don't require many books in this program. We just have a few. It could be, I mean, our students have complete access to our library, which is pretty substantial. So it could be a link to an article from our library. It may be a reading from a book. It could be find your own reading. It might be a video from YouTube or some other website, for example. We've also signed a contract with CAPC, the Center to Advance Palliative Care, and our students love using the CAPC website. They do have little online courses, which we will use through our coursework, but you have access to the entire CAPC website as a student in this program. So students tell me they kind of go down all those little rabbit holes and they get lost for hours exploring the CAPC website because they love it so much. So you've got your learning objects. These are the things that will help you acquire the knowledge that you need to accomplish the module learning objectives. And then we always have 1 or 2 discussion questions. So it could be, based on this reading, how would you answer the daughter in this case, for example? Or it could be, here's a little video clip of a patient using a meter dose inhaler. Can you point out what the patient did well and what they did not do well? So you would post to the discussion board your own post by Thursday night at midnight, and then you're required to respond to 1 or more colleagues by Sunday night at midnight, again, all in your own time zone. And then the faculty participate in the discussion board. Often the faculty will ask like a probing question to take you to the next step, or give you a link to an article and say, well, you know, I see what you've written there, but what do you think about this article? How does that influence what you wrote as your opinion about this? And then every week there's either an assignment or a quiz. So the assignment could be, you know, write a 300-word position paper on how you would handle this case, or it could be record a 2-minute elevator speech if we're talking about using a metric, for example. We just wrapped up 601 for the spring semester. The last activity was develop a wellness plan, because we talked about wellness because there's a lot of burnout. Oh my goodness, especially right now, everyone's under a lot of stress. So we really mix it up. It's never boring. It's always, I think the best compliment I get about this program is how practical it is. Students tell me time and time and time again, I learned this Monday night and Tuesday I used it at work, which is my favorite thing to hear. Okay. Some features of the program, I think I've covered some of this already. You have so many choices in this program. When to start, you have choices about which electives to take. And because it's asynchronous learning, meaning it is very rare that we would have something where we would say, Tuesday night at 8, you've got to do this. The only time you would have to do that, and it's very rare, we only have a few group assignments in this program. I'm not a huge fan of group assignments, but we are teams in hospice and palliative care. So your group may decide to jump on a conference call or not. You can use Google Docs or however you would like to proceed. So it's asynchronous learning. Some of you work days, some of you work nights. Some people like to front load their work in the week. Some would like to wait more toward the middle of the week. So it is asynchronous. You do your learning when and where you would like. You never, ever, ever have to travel anywhere. You never come to Baltimore. But we do generally have a celebration on our campus in August. Unfortunately, I just had to cancel the live celebration for this August, but I hope we're back on track next year. So again, completely online, very affordable tuition. I'm sure Eric will post the link to looking at our tuition, but in-state in Maryland, it's about $1,800 a course. Out of state, it's about $2,400 a course, and there are 10 courses in the program. Nationally recognized interprofessional faculty. I urge you to go to our website and click on the faculty page, because we have the most amazing faculty in the world. I am pretty shameless about calling one of the biggest names in the world and saying, you may or may not know me, but would you like to teach in this program, because it's pretty cool? And I got to tell you, nobody teaches for the money, because you know, teaching is not a profession to order your next Mercedes from. But we get these huge names who are so devoted to giving back to the profession. I'm humbled by the faculty that we have in this program. I really am. So again, 10 courses, 30 credits for the masters. We have the 5 certificates. Each semester is 8 weeks long, and we absolutely welcome international students, and we have many in our program. Application deadlines. Here's the website. Just click on admissions. If you're interested in coming this fall, July 15th is the deadline. I would not wait right till the very last minute because it takes a while to get your transcripts in. When you apply, it's all done online. You write a brief essay, like a couple of paragraphs, why you want to do this. You have your official transcripts all submitted electronically, which is very easy to do. And you put forward 3 names of people who can write you a letter of reference. The computer says your old college professors, but I think the computer still thinks everybody applying for graduate school is 22 years old after they finish their bachelor's degree. It can be any professional reference. It can be your supervisor, somebody who works for you, a colleague, just not your mother or your girlfriend, I guess. And then if you're applying for the spring semester, the deadline is December the 15th. We are waiving the application fee between now and the end of this month. Make sure the way you do that is you start your application, and then when you get to the point where you have to pay for it, you put it on hold and you email, it's all on our website, gradapply@umaryland.edu, and put promo code in the subject line, and they will send you the code so that you can get that waived. And this is my kind of tug at your heartstrings slide here. If you're the kind of person who flourishes in the process of self-discovery and lifelong learning, you want to explore every opportunity to achieve fulfillment of your personal mission. I know learning every day is part of my personal mission statement. Enjoys the process of discovering evidence-based practice. I think that's so important. I mean, how many times do we say to ourselves, you know, I've got this. I know what I'm doing with this. And then you do a deeper dive into the literature and realize, you know what, there's a lot I kind of have forgotten or has developed since I did a deep dive. So I really enjoy constantly challenging myself. So we are caring for very fragile patients. And the next one, thrives in a transdisciplinary practice environment, generating seamless and synergistic best practice care for patients and families. That's so important to me. I love bringing my expertise to the table. So I am a pharmacist by training, and I've worked as a hospice and palliative care pharmacist my entire career. I love what I do. I love making a difference. I love helping the team achieve pain control for a patient so that somebody dies pain-free or not vomiting on their sneakers. I love de-prescribing, taking away medications we don't need anymore. But I have to say, I'm 10% social worker and 10% chaplain and 10% something else, nurse maybe. And I live by this. Live as if you were to die tomorrow, but learn as if you were to live forever. I have a business degree, my PharmD degree, a master's in instructional design, and a master's in distance education. So my stars really aligned with all 4 of those and my clinical experience to pull this program together. And I could not be prouder of this no matter what. So with that, I would be delighted to take any questions. Please unmute yourself if you have a question, and let's see what's on your mind. Eric, did I forget anything that you want to throw in?
Not that I can think of. All the links to apply are down the bottom. The email address, my email address. I'm always happy to answer any questions anybody has.
Perfect. Yeah, my cell phone is in my email. So if you email me, I'm happy to share that with you. I'm happy to chat by phone anytime. Eric is your new best friend because he is always in close contact with the graduate school. So very helpful to talk to him whenever you have a question. Does anyone have a question for me? Somebody must have a question. Let's see who can stump the chump here.
Nothing to stump you with. My name's Ashley. I'm an emergency room doctor. I do both pediatrics and adult. Do you guys do any training as far as the pediatric component or any coverage of that in your program, or is it kind of?
Yes. In our clinical management of special populations, we do have a chunk on pediatric care. But just like I told the veterinarian, all throughout the entire program where you're asked to find a case, you can find a case that represents your practice. So for example, when we talked about spinal cord compression, the veterinarian talked about a breed of dog that loves to get spinal cord compression. We all learned a lot from the veterinarian, I have to tell you. So we do spend some time looking at pediatrics, but we urge you to represent your practice as well throughout the program.
Thank you.
Sure.
Thank you for the presentation. It was lovely.
Thank you. Do you suggest we have some clinical experience before applying for this? Let me see. Let me go to click on chat so I can read this completely. A new nurse grad. No, you just have to have a bachelor's degree. We do have people who've never practiced in hospice and palliative care, and it's hard to explain how we pulled this off, but I struggled a long time with how to address disparate learners. I mean, how do I not bore the doctor, but then not overwhelm or kill the chaplain when I'm talking about a clinical topic? And we've pulled it off. Sometimes in a course, I'll break people into team body, which is the doctor, nurse, advanced practice nurse, pharmacist, or PA, and team soul, who's everybody else. And they may have a different assignment or different aspect of the same discussion question, depending on your point of view. No, we have brand new graduates all the time. As a matter of fact, as an experiment, we've even accepted some senior PharmD students and medical students, MSW students, and advanced practice nurse students in the program, and they've done just fine. So we welcome all learners. This is a wonderful, wonderful program. And also, I would like to extend the offer that if any of you would like to speak to someone in our program of your discipline or any other discipline or similar circumstances, Eric and I are happy to connect you with someone so that you can chat with someone offline who can give you the real deal. One question that comes up a lot is, how much time does this take? At the middle and end of every course, we do a survey of how things are going. And I ask that question, how many hours does this take you? And there's a pretty wide range. I would say to do a really good, I think you get out of this what you put into it. But if you want to do a really good, competent job, I would say it's about 8 hours a week. So about an hour a day. I think the key to success, and I tell this to faculty too, is to do a little bit every day. You don't want to wait until it all piles up, because then it's like, oh my gosh. But if you do an hour a day, maybe the first couple of days of the week, you look at the learning resources, you do your CAPC course, you do your readings, and then by like Tuesday, Wednesday, you jump in with your discussion question posed, and meanwhile you're working on your assignment. We have people who say they can do a fine job in 5 hours a week, but then we have people who say, I spend 15 hours a week. But sometimes those are the people who perhaps are not working full time, and they have the luxury of spending 15 hours. And I got to tell you, when people get on that CAPC website, they go crazy and go down all the rabbit holes because they're having such a good time. So again, I think about an hour a day is a good approximation of really getting the most out of this program and not making yourself crazy. We've designed this program for the busy working adult, people who have children, people who have a family, people who are working full time. And I have to say, the faculty are extremely open to, we know life happens. So for example, this past semester, the latter part of spring, with the COVID epidemic, we were very flexible with deadlines, for example. And in one course, we actually deleted a couple of assignments because not only was it a lot of work in that course, but that was a heavy emotional lift. And on top of everything that was going on, we felt it was appropriate to take off 1 or 2 of those assignments. So if something comes up, if you say, look, it all hit the fan and I have to work 2 doubles in a row, so there's no way in the world I'm going to make Thursday night, just email your course manager and let them know. If something comes up, someone in your family is ill, you get sick, whatever, just let us know. We're very, very accommodating. I'm very proud of how the faculty has a real life practical approach to what we're doing. Nobody's anal in our program. I promise you that. Other questions? Either unmute or put in the chat box.
Hi, can you hear me?
Yes.
Oh, hi. Thank you for this information. So I don't know if I missed this. I came in a little bit late, but I'm a P2 rising P3 in the School of Pharmacy. So I guess, is this more of a, would it be a dual degree kind of thing, or how, can anyone apply in any of the years, P1, P2, P3? How does it work exactly?
Are you at our School of Pharmacy, Maryland?
Yes, I am.
Okay. You're a rising P2, you said?
Rising P3.
Yeah, P3. Yes, you are eligible as a rising P3. I sent out an email to your class, or anybody who's got a bachelor's degree can apply, regardless of what year in pharmacy school.
Okay.
So you can certainly apply for the as a rising P3.
Okay, thank you.
Yeah, of course. Anyone else have a question? Eric, anything else I've missed that's occurred to you?
not that I can think of.
Okay. Well, I'd like to thank you all for joining in. We're very appreciative. And again, don't forget May 31st to waive that application fee. And if you have any additional questions, please let Eric or I know. And I hope we get the opportunity to work with you. Thanks so much. Have a great day.